Welcome.
Thank you, everybody. Thank you, my professor. I'm very glad and very honored to present my proposal here in London. And my proposed proposal, ethical practice and monitoring progress of universal health coverage for achieving sustainable development goals in the context of Bangladesh.
So please read, and you have to tell people the table of contents. Well, you can start, for people following, so this is chapter 1, you're going to read through.
My proposal comprises chapter 1, which includes context. Introduction includes context, aim and objectives, organization of the study, research portions, and significance of the study. And number 2, chapter 2, it comprises research design, research method, research design, which includes research methods, research respondents, research instruments, data collection, and data analysis. And chapter 3, which includes literature review, which includes background information and ethical implications. Chapter 4, results and discussions. And chapter 5, lastly, proposals with conclusions and the recommendations. Finally, bibliography, references, and access. Okay, now my context, introduction, context. In the year of 2015, the WHO Director General Dr. Margaret Chan asserted universal health coverage is the single most powerful concept that public health has to offer. And the United Nations General Assembly was then considering proposals for sustainable development goals, succeeding the Millennium Development Goals. And sustainable development goals focusing on the health specifically includes universal health care coverage among its targets. WHO first endorsed universal health coverage in its 2005 resolutions on sustainable health financing, calling on states to provide access to promotive, preventive, curative, and rehabilitative interventions for all at an affordable cost. In the year of 2015, the UN and its member countries adopted 2030 agenda for the sustainable development, comprised of 17 sustainable development goals. And the goals cover areas such as poverty, education, health, and climate change, as well as peace, justice, and access to strong governing and institutions. Some who endorsed sustainable development goals. Try to show the goals in a table. There are 17 goals and some targets, who endorsed targets, which is related with the sustainable development goals 3. I am mentioning from the table, goals table 3. Goal 3, it ensures healthy lives and promote well-being for all at all the ages. it is related to my proposals mainly. And when the Millennium Development Goals were published, 3 of the 8 goals were directly related to health, targeting maternal health, child health, and diseases like HIV or AIDS, malaria, though now contain just one goal. The health objectives of Agenda 2030 are considerably broader in scope. The founding agenda report envisions a world with equitable and universal health coverage, which access to universal health coverage and social protection, but the physical and mental and social well-being are assured. Sustainable Development 3 ensure health lives, promote well-being for all and all ages. Moreover, the report states the following: to promote physical and mental health and well-being, and to extend life expectancy for all. We must achieve universal health coverage and access to quality health care. No one must be left behind. We are committed to prevention and treatment of non-communicable diseases, including behavioral, developmental, and the neurological disorders, which constitute a major challenges for sustainable development. Here are the targets associated with Sustainable Development Goal 3, and from the targets, 3.8, it mentions achieve universal health coverage, including financial risk protection, access essential healthcare services, and access to safe, effective, and quality and affordable medicines and vaccines for all. It is related with the Sustainable Development Goal 3. These all are who endorsed. So, in the context of Bangladesh, Bangladesh sets the targets to reach the universal health coverage goal by 2032. So, universal health coverage, what is in Bangladesh context? It is a way of preventing people from falling into poverty due to heavy expenditure during medical treatment. As because Bangladesh is the concept is that people should have access to quality health care without getting into financial trouble. So if we cannot say the priorities, then the journey can be lost. So for achieving universal health coverage in Bangladesh perspective, the first focus should be on making government facilities at Upazila and the level below useful with adequate workforce and equipment so that people take services there. And in many remote places, the government services are not functional and there is no quality of care. So if we can bring them to the government facilities, then their cost of treatment will be reduced. The World Health Day celebrated in our country, that means in Bangladesh, it was celebrated in the year of 2018 on 7th April, and it was themed on universal health coverage for everyone, for everyone. Calling upon the countries to provide quality healthcare services to all when and where they are needed. My next aims and objectives. In my proposal, the aim of this study, which is to investigate the extent to which local government units have complied with the provision of who endorsed Universal Health Coverage Resolution 2005 on the sustainable health financing to provide access to promotive, preventive, curative, and rehabilitative health interventions for all at an affordable cost. This research seeks to answer the following queries. Number 1, to assess the effective monitoring progress of universal health coverage between the local government officials and the political leaders and the general public, especially not general public, conscious civil society. Number 2, to determine the ethical practices of universal health coverage for achieving the sustainable development goals to promote quality health care. And number 3, to come up with a sustainable action plan to promote and monitoring physical and mental health of the people and to extend life expectancy for all. Okay, then next, the organization of the study. Study will comprise 5 chapters. Chapter 1, context, scope, aims and objective, organization of the study, research questions and significance. Chapter 2 encompasses research design, which comprises research methods, environments, respondents, instruments, dry run procedures, data collection and data analysis. Chapter 3, it highlights literature review, which focusing on ethical practice and monitoring of universal health coverage for achieving to endorse various goals and targets to individual communities as well as people of the whole country concerned. Chapter 4 elucidates on the discussion and analysis of the findings, and Chapter 5 presents findings, conclusions. It will present future the findings, conclusions and recommendations. My research question. First, the aim of this study is to investigate the extent to which local government units have complied with the provision of who endorsed goals and targets for all the people of the whole country concerned, and specifically the research seeks to answer the following questions. I discussed earlier already. Now the significance of this study. This study is of interest of various stakeholders of the local government units. Excuse me. The significance of this research to the various stakeholders is expressed in the following section. The local government units and staffs, local government officials, conscious civil society, and many more. The non-governmental organization, UN, academia, so local government units and staffs. The study will provide the local government units and staffs with better insights as to the effectiveness of their existing practices and use these to come up with an intervention scheme in designing and implementing sustainable development goals and targets. And the local government officials, the research is significant to the local government officials as it will provide them with the baseline data on the current condition of their respective communities, ethical practices, paving the way for the creation of information and education campaign to effectively raise the awareness of the general public and motivate them to observe the achievement of the goals of sustainable development. And the concept civil society. The civil society will stand to benefit from this study by ethical practices of universal health coverage, which will minimize negative human and environmental effects of sustainable development goals.
You need to make it bigger. You got lost. Where are you up to?
Chapter 3.
Chapter 3?
Yes.
Okay, good.
Now, the chapter 3, the background literature review, it includes background information and ethical implications. So, background information, at least half of the world's population still don't have the full coverage of essential health services. Over 800 million people are still being pushed into extreme poverty because they have to pay for health care. All UN member states have agreed to try to achieve universal health coverage by 2030 as a part of Sustainable Development Goals. So universal health coverage is the goal that all people receive the essential health services that they need without being exposed to financial hardship, and it is central to the health-related targets of the Sustainable Development Goals. You will see that this universal health coverage is both an end in itself and as expressed in Sustainable Development Target 3.8, as well as the most logical way to ensure progress towards meeting other health-related targets. Two indicators were adopted by the UN Statistical Commission in March 2017 to monitor progress towards the Sustainable Development Target 3.1 on universal health coverage, which namely the coverage of essential health services, that is Sustainable Development Goal Indicator 3.8.1, and the proportion of household with large expenditure on health as a share of total household consumption or income, that is Sustainable Development Goal Indicator 3.8.2. Then the 2030 agenda builds on the Millennium Development Goal, which were adopted by UN in 2000, and it will expire. It expired already in the year of 2050. So the 17 SDGs are accompanied by 169 specific targets, and thought is still under constructions, and some 230 indicators. The goals are to be implemented via a global partnership carried over from MDGs, comprised of governments, the private sector, civil society, UN agency, academia, the scientific community and other stakeholders. Crucially, whereas the MDGs targeted only developing countries, the SDGs apply to all UN members. This means that various address the disease were mostly a matter of external policy via foreign and development policy mechanism. The Sustainable Development Goals require internal policy responses both by European Union and its member states. Now the ethical implications. One of the pressing challenges confronting many developing countries like Bangladesh at present is over-accumulating quantity of universal health coverage generated without adequate facilities and resources for ethical practices. So, ethical practice of universal health coverage to the environment and human health in Bangladesh cannot be solved merely by technical and regulatory solutions. There is need to undertake a collective effort from all sectors of the community to find acceptable and ethical solutions to the problem, sustain a safe environment and a quality of life for current and future generations. Integrating ethics to maximize the benefits and limit the potential adverse effects in the monitoring progress focuses on two classes of ethical concern. The first is the achievement of intergenerational equity, which involves choosing technologies, strategies to minimize the resource and risk burdens passed to future generations by the current generation for achieving sustainable development goals by ethical practice and monitoring progress. It is a fact of life that each generation leaves a heritage of austerity involving a mix of burdens and benefits. This is unavoidable. But man's action and decision will be more acceptable if appropriate degrees of equity or justice are respected and he doesn't unduly restrict the freedom of choice of future generation. Countries over time experience development with the growth of industrialization and globalization. Questions have been raised if this development is sustainable. So sustainable development is an environmental concept placing the emphasis on intergenerational quality focus on future development of the world, sustainable use of the environmental resources and services are very important for sound environmental development. The second concern of this achievement is intergenerational equity, and in particularly an ethical approach to the handling within current generation, and of questions of resource allocation and of public involvement in the decision-making process pertaining to practices of universal health coverage for achieving sustainable development goals and targets. The study provides an ethical analysis of different USC strategies adopted by the local government units, primary healthcare personnel, that means non-governmental organizations, UN academia, and the civil society. Here are some references to the questions. These are all. Thank you very much.
All right, now go through the questions at the end there you're asking.
Yes.
So what's the focus group? This is for your study? The focus group study?
Focus group.
This is what
Focus group, yes.
Explain, please. Your proposal?
Yes.
So you have appendix 1 is household questionnaires, to number
Yes.
2, focus group. So you can explain the focus group,
Yes,
please.
focus group discussion, it is a part of undertaking to gather some data on the effective monitoring of universal health coverage and its impacts on the environment and attainment of sustainable development for the community. So the information gathered from this discussion through in-depth interviews, which will be used as a basis for coming up with a feasible plan to improve the sustainable development goals and targets. Thank you for
And then Appendix 1, please. Explain. Appendix 1.
Yes, my appendix 1, that is household questionnaires. Actually, the goal of this survey is to gather information on ethical practices among the household members in my community. Actually, my community household members. That is kindly answer the following question based and the questions will be, have you been educated on universal health coverage for achieving sustainable development goals and targets?
Number 2.
Number 2, do you know about the concept of universal health coverage? Yes or no? Do you know about the concept of number 3? Do you know about the concept of sustainable development goals and targets? And do you participate, number 4, do you participate with other local government units and the focus group discussions for ethical practice and monitoring progress of universal development? Actually, it is a question here for gather the for achieving the question answer and the link between the local government units and the focal group discussions. Then number 5, we want to achieve sustainable development goals. These are all, and thank you for.
Okay, so now the floor is open for questions. Justin, would you like to start? And please, you get a pen so you can take notes. You want to see. Sonia.
Yeah. Universal healthcare is a very ambitious target. Even in Britain, the NHS is struggling. It would be better sort of trying to identify what are the minimal healthcare provisions which would be available in the universal healthcare. Because medicine is advancing, suddenly in the last 15 years it has advanced quite a lot. And with each advance, it's becoming more and more expensive. So even developed countries are finding it difficult to catch up with the expense. Let alone countries like Bangladesh or others. So I think sometimes they haven't quite identified is what are the minimal healthcare provisions they want to make universal. In the field of human rights, it's quite simple. Things like you won't be tortured if you are arrested, then you have a right to a lawyer and things like that, and you're not considered guilty unless proven otherwise. And these are things these are the grey areas which are not identified in the universal healthcare, which makes it not sure, I don't think the word is abused, but it gives a scope for different countries to provide differential care. Some might think just relieving pain and giving antibiotics. is the best they can do, well, is all they need to do, they can do more. And others like NHS where there's sometimes debates within the media about the latest cancer treatment, which is hugely expensive, whether to give it to a patient or not to a patient when it's proven efficacy is not yet hasn't gone through a proper study. So, though I think that's one of the big challenges.
You need to make notes. What are you going to do?
It's a big challenge. Actually, it is a big challenge, and it is challenging in our countries like Bangladesh, as a third world countries. Now we are declared we are developing countries, but already the developed countries they are taking sustainable development goals, and they are who endorse some goals and targets for achieving sustainable development goal after the Millennium Development Goal. So they are going fast, and they are going. They are taking its challenges. Their challenges, but in our country, Bangladesh, I'm trying to focus in our the local government units and at the same time the non-governmental organizations, then the United Nations Academia and our civil society. All are how they are collaborating, and actually I want to explore their communications, intercommunications, and what are the thoughts, what are their thoughts. And I will try.
Other questions or comments?
Yeah, can I?
Ready? Yes, please.
Can I see your content list, please?
Is it connection list? Missing.
No, content list.
Oh, content. Oh, yes.
The research respondents, research instrument. I mean, what do you want to do here? It's not very clear to me.
Actually, my research respondents will be the local government units, then local government officials, actually the decentralized in the city, and then the Guzilla, Thana level, decentralized officials, then our non-government organizations and their admins, then our conscious civil society, of course conscious.
Okay, so is this from where you are collecting your data?
Yeah.
So how it's different from the data collection? Because you mentioned in 2.4, it's data collection. So how it's different from that?
To data collection, I will prepare 3 questionnaires. One is for focus group discussions, another for the general conscious civil society, and another for the local government.
So that's the questionnaire part.
Yeah.
So maybe when the research respondents, if you want to imply the data collection there, so it's better to imply questionnaire in 2.4. Otherwise, for me, I don't know, honest, for me it's a bit confusing. Research respondents and then again data collection.
Could you explain using the mic? Because I can't hear you.
Okay, so when you say the research respondents, you are implying that those will be the units from where you want to send the questionnaires and collect the data, right? So it's a part of your data collection. So why separately you are mentioning data collection?
Oh, that.
So in the data collection part, you want to mention the questionnaires. You want to give the question structure, isn't it?
Yeah.
So another thing is, you can think about it later on. So, and you mentioned about the research queries. Some of the research queries you want to address, you want to answer, and then you mentioned separately in the research questions.
Yes.
Right? So that's another confusing part for me.
Yeah.
Okay? And in research queries, there is one that you want to see the how it's working between the political leaders and the healthcare sector, something like that.
Primary healthcare personnel like doctors, nurses.
And the political leaders. Is it very feasible? I mean, what's the idea in your head to?
Actually, the political leaders will go to will march with the conscious civil society. They will also march with them.
Okay. Right. So I don't know how tough it is to get the data from the political leaders and also from the healthcare workers working there. So it's a hard task for you.
Of course.
Right? It's a hard task. And for people who are not from those Asian countries, they don't get what the Upazila means.
Yes.
So I think
In our context, in Bangladesh context, they will
it's fine. If you're from India, Bangladesh, you will get to know that what Upazila means. But not other people.
Yes.
Right? So if your thesis is going to US, they won't understand what Upazila is. So you need to give the word in the bracket name. And correct your typos, whatever you have, before the final version. And I'm very happy that you chose this subject. She's initially me and one of another person who was also a part of AUSL. So we thought to do a study on the universal health coverage, which we have in India as well. And they're trying to meet the targets there for the SDGs. So we tried to, we had the thought to compare both the countries' universal health coverage and to work on it, but that never matured. So I'm happy that you chose this subject. Well done. Thank you.
Thank you very much
Thank you, Reddy.
for your advice.
Thank you.
I think, Meena, you have some comments?
If that's okay.
Yes, please. So Sonia will take notes.
Sorry.
Yeah, please go ahead, Meena.
Sorry, I can't.
Please go ahead.
Okay, thank you. Thank you very much for your presentation. And just to give you a background, before I make my comments, I teach research methods in international health, so I'm very critical of the methodology side of things, and I supervise PhD and MSc students here in the Tropical Medicine. So I've been going through your proposal quietly without listening to you and making some quite elaborate comments on the proposal that I will send to Darryl, and you can have a look at them. So I hope they might be useful, and so I will send when I finish reading through your document. Couple of observations very briefly. It's a very good idea at the moment. However, so far, what I have looked at the proposal is, I think it's relatively a bit PhD or master's level is that the tip for you would be, please be very, very careful when you are writing your research questions and the terminologies that you use and how your methodology would fit into the research objectives or vice versa. Because if I was examining dissertations, when I examined dissertations, that is one of the very critical things that we look at the School of Documentary. So that is my first observation. The second would be about with regards to your questions around descriptive nature of the study. I believe this is not a descriptive study because within the second, in the very beginning in research methods, you would say that it involves both qualitative and quantitative data collection methods. So it is a mixed method study. So it is not purely descriptive. So I will stop there, I think, for the moment, but I'm going to work very, very carefully and editing it as much as I can today, and I will send it shortly my quite detailed comments on the draft to Darryl and have a look at it in your leisure time. And but it's a very good idea, and it's worth exploring as a topic. So good luck with that, and I look forward to hearing about your dissertations and the progress of it next time. Thanks very much.
Thank you very much.
Go ahead.
Actually, my research design or methodology, yes, I think maybe it is. Yes. The study will be descriptive in nature. You were telling that it will not be descriptive in nature.
Saying it's a mixed method.
Mixed method. So I am also mentioning the quantitative and qualitative data collection method will be included here. It will be included.
I would suggest that maybe we can have this discussion separately, that is not without calling on other people's times, but I'll send my comments shortly, and then we can have it agreed that we can have a discussion later. I think it needs to pick up editing it.
Thank you. I will. Thank you. I will do.
Okay, thank you. Sonia, so can you, I want to put up here, to further examine here. Research respondents, LGUs means local government, U means
Actually, local government units.
units.
Units, yes.
So it's members of local government units because they're people working in local government units.
Units.
Yeah? Because it's not the units who are respondents, but the members of them. Primary personnel staff. Now what about citizens? Why don't you include ordinary citizens?
The citizens, every citizens are not the educated citizens. That's why I am mentioning the conscious civil society.
So non-educated people can't talk about universal healthcare?
No, they are not the. They will be aware of the, or they will not be conscious about the universal health coverage and the sustainable development goals. I think so.
You think so?
Yes.
But in the high school, it's taught to everybody
In the
about.
high school level.
Yes. So it's been taught for the last 10 years. So any young adult in Bangladesh should be aware of government priorities for healthcare, don't you think?
Because in our textbook in Bangladesh, our textbook is still not including textbook doesn't any information regarding the sustainable development goals and targets. Still not. So.
But in the newspaper, is it not mentioned? In the newspaper, you don't have a story about...
Yeah. So they have to be conscious.
And have political...
Educated civil society, they have to be...
Yeah. And what about...
to achieve the knowledge, actual theme and knowledge regarding the universal health coverage.
And do politicians in Bangladesh promise better healthcare when they go for elections?
Of course, they will...
They promise for many years.
Yes, they are for being a political leader, they have to be promised
So
to the general people.
So is it
You will
useful?
do something for the country.
So is it useful to ask ordinary people, are you satisfied that the politicians delivered on their promise to give you better healthcare?
They are just giving promise, but
Not
they
keeping?
are not executing. The executing members are the local government units. They will execute it, they will not execute.
So that they know. So that's why you can ask people about their awareness, if the UN has any relevance. So for example, some years ago, Professor Jasdeep Rai and I wrote with two other colleagues a book about the UN and suggesting that its goals of the United Nations may be removed from ordinary people. So if we ask ordinary people, we can show if they really don't know or if they have a hope. So we could also ask Tahira, who worked for the UN FPA in Bangladesh, if people in Bangladesh have a good image of the UN. I don't know, Tahira, is that true? They have a good view?
She is a healthcare personnel.
Tahira, would you like to comment?
Comment.
Yamina, go ahead.
Yes, I just wanted to have a clarification if the speaker has the knowledge of, I put a proposal on UNC in Bangladesh 2 years ago to see, so I have a little bit of knowledge behind this. I know that the Ministry of Health and Family Welfare of Bangladesh has joined the learning network of UNC coverage, so I don't know whether she has looked at the initial pilot scheme of the Ministry of Health. Have you?
Have you looked at these guidelines 2 years ago?
Yes.
And what's
Ministry of... Please.
UN?
It's the health economics unit of the Ministry of Health and Welfare had joined the joint learning network of UNC, the International Forum, and they initially had started a pilot scheme for social health protection in semi-urban and rural areas. And it was started by the Health Economics Unit of the Ministry of Health and Family Welfare. So I wondered had she looked at that scheme initially before she started drafting her proposal.
Maybe it's good. You can look at that further. Yeah.
Thank you.
Yeah, I did put a proposal on the same topic 2 years ago. It didn't get funded, but I didn't know that it was funded. So I thought it would be a good starting point to provide a background picture to your work before you actually start data collection, because there is already an existing pilot system. Maybe you can have it as an objective to improve, to evaluate that as a program that is existing in the Ministry of Health and Family Welfare.
Thank you, Nina.
That question
Yes, Sonia. Yes, Sonia.
Yeah. Very interesting discussions. Actually, the germ of the idea is good because the local government officials do have a lot of responsibility towards health, and especially epidemics and other issues. But as Daniel said, the locally elected leaders, in the urban areas, the ward commissioners, and the rural areas is the union Parishad, the chairman and the members. They also include members who actually don't even know what they're supposed to do. So this is something that this sort of a study, if it is very guided, it will lead to more of the onus on the local government, especially the idea of returning the citizens means the citizens' voice, and that is lacking in Bangladesh. The citizens' voice is that if an MP is elected from a district, that MP should be accountable for the maternal health and other health of his or her constituency. That is to come from the citizens. So if she questions citizens and this comes out, then definitely this will be something which can be brought up to a higher level, and it is already brought up, but this study will be helpful and the media can help in this. Secondly, the UN, there are several interactions and programs with the UN and the different UN agencies and the local government. I myself had initiated the Urban Primary Healthcare Project, which was with most of the municipalities and the city corporations. And this was really for the poor and going through the NGOs. And it was a partnership between the UN, the government, and the NGOs. And we had, even the ambulances, the UN had given it free, and the government had paid the taxes and the NGOs made it free. And there was a rate where the fees would be 30% of the clients, of the patients, would have free of cost treatment, including cesarean sections. But the others would get some, they get system. And I have also worked with the UNDP on a consultancy with local government, and they are also working very closely with the local government leaders, particularly at the rural side, not at the urban side. UNDP had worked with the urban side. So my suggestion to Sonia would be, it's a good proposal, but you have to polish it up, make it more focused, and focus on urban area and the rural area, because your population is quite different and the needs are different. And so the commitment of the leaders and the local government is very important. And local government is really in charge of disease like malaria, epidemics and so on. So all this together will make a good study. So it needs good commitment, it needs to be tightened up. And it's not really so inarticulate, it's quite articulate. But I think Mina's comments and all of us, if we read some written comments and we look at it, this will be a very useful study. And this is what I found from my own experience in the UN. So I hope that it answers your question. Thank you.
Thank you, ma'am. Thank you.
Thank you very much. Does anyone else have any comments?
I don't have comment, but I congratulate Sonia. It is a good topic, especially. The Bangladesh, this population needed this study. I think that it will improve healthcare approaches. And the methodology I want to learn also. Mina did some criticize. I believe that it is very helpful for the Sonia. And thank you. All of the presentations are very necessary topics and good presentation. Thank you.
Okay, thank you, Sukran. Yeah. Any other comments? Anyone? Any comments? So public health care in developing countries is quite, we have middle income country where, like Thailand, which has made universal health care work. And other countries such as China and India, the big countries, which have a huge challenge because of the numbers. Bangladesh, I think, is the biggest challenge the lack of money or the disorganization. What is the biggest challenge to deliver universal health care in Bangladesh, Sonia?
I know it is a big challenge for Bangladesh, but I want to explore something different, the activities and activities of the core departments, especially the government, local government, the central government, then the non-governmental organizations, NGOs, admins. Yeah, I will explore what is their targets, what they are doing for the general people for achieving actually the essential healthcare services. The general people are getting, actually they are getting or not the essential health services. So I want to explore. I don't know what will be the result, but I will try my best, and I know it is very tough for me, but I will want to.
And right now, what do you think is the biggest challenge?
It's a big challenge to reach them.
Delivery?
To reach them and deliver my message and my questionnaires, my interviews. Everybody will be available or not. They will cooperate me or not. Just these will be the big challenge for me.
So it would be rural-urban divide that Tahira mentioned.
Yes, and general people, that is local people, and the local area and the urban area. It will be very tough to reach the area for me. Let's see.
Yes, Tahira, go ahead.
Yeah, I think that the guidance will help. The biggest step, as we all know, I'm sure Sonia is part of Sonia's proposal, which I couldn't read properly. It's the biggest step, as you all know, is that doctors don't stay in their workplace. That's why you don't get quality of care, and they don't see the anesthesia machines. Yes, they don't see the OT machines are OT lights are working. They don't see the medicines are there. They come and take the ceremony, spend some time, go back, or they have their own clinics and all the patients are there, seen there. This is a very, very big problem for the government because many of them are on training in Dhaka. They've already got training, they're gynecologists and anesthesiologists. Now, if you don't have a team, if the anesthetist does not anesthetize the patient, no surgeon will touch the patient. If the anesthesia is gone for 3 months here, then it's impossible. The patient doesn't get treated. So the problem in Bangladesh, as we all know, is that if you look into the manpower, there are more than 56,000 doctors and half are nurses. More doctors than nurses. It should be the opposite. There are more nurses than doctors. So, but they're not in the stations. So my question is that how do we address this? How do you keep doctors in the rural areas? Why are they not found to Dhaka? And if we can solve this problem, there have been various pilots in this, and it is difficult. And then the private sector was asked to really encourage to go into the rural areas also. But it's now found, if you look into the recent 2016 maternal mortality survey, that the the metal mortality rate has increased from 2010 to 2016. Now it is 196, it was 194. So why was it? This is the quality of care. More than 80% of deliveries in private sector are C-sections. They are not needed, they are not equipped for it. Many of the mothers are dying because of this. So you are right. The biggest problem is quality of care, and quality of care means the manpower, means supplies, logistics, and of course the other cultural and logistics like transportation and all are very important. But poverty is also a big challenge. Without money, you don't get anything. So this is something that we all have to think of. Number one, as the was poverty, and it's still, I think, a big problem for Bangladesh. Thank you.
Thank you.
Thank you, Tahira. Yeah, so in conclusion, I think, of the discussion, we have to develop further research questions and link them to the objectives. We need to think about the biggest challenges, also what the previous proposals have been, why they failed or did not succeed to introduce universal healthcare in Bangladesh. I would suggest also the political parties, what they promised and what they could deliver, because I think many of the political parties have spoken that they'd like healthcare as they promised in every country, but they usually don't deliver. And in the same sense, the UN officials are also promising to the world, for their own sake, be better healthcare for everybody, and the governments are trying to do this, but how do they actually deliver? I also find it interesting to compare MDGs and SDGs. And also before MDGs, there's been goals of UN.
Yeah.
Every 10 or 20 years there's new goals. And they always try to achieve everything, be it 1945, 1955, 1990, 2000, 2015, and in 2030 they're going to make a new development goals again. So it will be interesting as we follow this. If we're lucky enough to be living in 2030, we can see the next set of goals. Because these goals go in cycles, and many governments make their 5-year goals, if they have a 5-year cycle, some have less. So eventually healthcare will be universal, but it'll be interesting how they go. So thank you for your proposal, and we wish the best of luck for you to succeed in doing it through focusing on the questions and objectives. Okay, do you have any concluding comments?
Thank you.
So thank you very much.